Your first 24 hours after Wegovy, 0.25 milligrams, or Zepbound 2.5 milligrams, may feel surprisingly normal. You may notice earlier fullness, mild nausea, or no clear change. None of these reactions predicts your long-term result. Use only the prescribed dose, eat smaller meals, drink steadily, and know which symptoms need medical attention. A quiet first day can still fit normal treatment. Wegovy contains Semaglutide, while Zepbound contains Tirzepatide. Both reduce appetite and delay stomach emptying, so your usual portion may suddenly feel too large. The medicine also enters your bloodstream gradually. That is why the first injection usually feels different from a fast-acting medicine. The timing also explains why the first few hours may be quiet. Wegovy reaches its highest level in the blood about 1 to 3 days after injection. Zepbound typically reaches its highest blood level around 24 hours, although the reported timing ranged from 8 to 72 hours. The starter doses are deliberately low, so your body can adjust more comfortably. Do not inject more because hunger remains at dinner. Do not move the next dose forward to chase a stronger effect. Extra medicine can increase nausea, vomiting, and dehydration without safely speeding the treatment plan. Check the injection site once after dosing. A small blood spot, brief stinging, or mild redness can occur. Press gently with clean gauze if needed, but avoid rubbing the area. If the device leaked or the injection seemed incomplete, contact your pharmacist or prescriber before repeating a dose. Both injections can be taken at any time of day, with or without meals. Normal activity can continue afterward unless symptoms interfere. Your first day should mainly be an observation period while the medicine begins working. Food matters because delayed stomach emptying can make a familiar meal feel unexpectedly heavy. Start with a smaller portion, eat slowly, and stop when comfortable fullness appears. Large fatty meals can worsen nausea, reflux, bloating, or pressure because more food remains in the stomach for longer. The most common early problems involve the stomach and bowel. You may notice nausea, burping, reflux, bloating, diarrhea, constipation, or abdominal discomfort. Headache, dizziness, and fatigue can also occur. One mild symptom is very different from a pattern that keeps worsening or prevents normal drinking. A manageable first day still allows you to drink, keep some food down, urinate normally, and move around the house. Mild fullness after a smaller meal can be expected. Repeated vomiting, severe pain, or dizziness when standing changes the situation because normal function is starting to fail. Write down when symptoms began, what you ate, and whether fluids stayed down. A short record is more useful than checking every sensation repeatedly. It can help show whether symptoms followed the injection, a heavy meal, alcohol, another medicine, or a stomach illness. The injection and your meal choices can interact. Someone who eats slowly and stops at early fullness may have only mild discomfort. Someone who takes the same starter dose, then finishes a greasy meal and drinks heavily, may develop stronger nausea or vomiting overnight. Continuing to eat after strong fullness appears can turn a useful appetite signal into avoidable discomfort. Side effects can still occur even with careful eating. The practical lesson is simpler. Let the new fullness signal change, portion size instead of trying to eat your old amount. The opposite mistake is skipping food all day because nausea seems possible. Long fasting can add weakness, dizziness, headache, and poor fluid intake. Eat modest amounts when hungry, and choose foods you already tolerate well. Fried foods, very rich desserts, and oversized meals are more likely to feel heavy. Fluids work better when taken steadily instead of all at once. Small drinks throughout the day are often easier than forcing a large bottle quickly. Vomiting or diarrhea can remove both water and body salts. Repeated vomiting that sends every drink back up can create dangerous dehydration. People taking insulin or a sulfonylurea need extra planning during the first day. Using Wegovy or Zepbound with these drugs can increase low blood sugar risk. A sulfonylurea is a diabetes pill that makes the pancreas release more insulin. Shaking, sweating, weakness, confusion, hunger, or a racing heartbeat can be warning signs of low blood sugar. Check your glucose if your treatment plan calls for it. Follow the low blood sugar instructions from your clinician, and do not change insulin or sulfonylurea doses on your own. Zepbound adds a separate issue for people using birth control pills. Its effect on stomach emptying is strongest after the first dose. Use birth control other than pills or add a barrier method, such as condoms. Continue for 4 weeks after starting Zepbound and every dose increase. Do not judge the first dose by whether your appetite disappears before bedtime. Check 4 functions instead: drinking, urinating, keeping down some food, and moving normally at home. Watch mild symptoms at home when drinking, eating, urination, and movement remain normal. Breathing trouble, fainting, or swelling of the lips, tongue, face, or throat can signal a serious allergic reaction. A severe spreading rash also needs urgent assessment. These symptoms are not routine adjustment effects. Seek emergency help because throat swelling can worsen quickly. Severe abdominal pain that does not go away is another danger sign, especially when the pain reaches the back. This pattern can occur with pancreatitis, which means inflammation of the pancreas. Nausea or vomiting may occur with it. Persistent severe pain needs prompt medical assessment. Fluid loss becomes concerning when drinks will not stay down, urination drops sharply, or standing makes you faint. Significant dehydration can strain the kidneys. Contact your clinician promptly for worsening dehydration. Severe weakness, confusion, fainting, or inability to keep fluids down warrants urgent evaluation. Upper abdominal pain with fever, yellow skin, or yellow eyes can point to gallbladder disease. This pattern is different from ordinary mild nausea. Gallbladder problems can occur during treatment with these medicines, especially when substantial weight loss develops over time. Use patterns instead of judging one isolated sensation. One loose stool differs from repeated watery diarrhea with dizziness. Brief nausea differs from vomiting every drink. Frequency, severity, hydration, and normal function provide a better safety screen than the mere presence of a symptom. After checking for urgent symptoms, ignore tomorrow morning's scale as a verdict on the injection. Overnight weight changes mainly reflect water, food, and bowel contents. They do not represent meaningful fat loss. Track weight under similar conditions over weeks, not after every meal or bathroom visit. The same patience applies to the dosing schedule. Wegovy injection starts at 0.25 milligrams weekly for 4 weeks. Zepbound starts at 2.5 milligrams weekly for 4 weeks. Do not increase early, and contact your prescriber if side effects become difficult before the next planned increase. The first 24 hours are an observation window, not a deadline for results. Keep meals familiar, drink steadily, and avoid heavy alcohol use. Do not combine the injection with an eating challenge or an unsupervised medication change. Too many changes make the cause of new symptoms harder to identify. By 24 hours, you may feel no clear change, notice earlier fullness, or have manageable stomach symptoms. All 3 can follow a correctly used starter dose. Judge the day by hydration, repeated symptoms, and normal function. Seek help for breathing trouble, severe persistent pain, repeated vomiting, or worsening dehydration. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.